3 cases of measles have been reported here in Iowa in the last 3 weeks.
This is concerning because these are the first cases in our state in 6 years. KCCI's Pepper Papura is looking into ways to stay safe. Pepper?
Well, Stacey, Iowa is the 31st state to confirm those cases. There are 33 total, according to the CDC. And now that school is out, people are traveling and daycares are filling up. Both things experts say people should remember when considering how to stay safe from the virus. School is out, and the busy summer travel season is here. But this year, there's a new threat that could ruin your vacation.
Measles is incredibly infectious.
Iowa's 3rd case of the disease was confirmed on Wednesday. Iowa Health and Human Services says an unvaccinated child in eastern Iowa tested positive. And like the first confirmed case in the state, they were exposed while traveling.
So one person with measles in an airport is, it's just a match in a powder keg.
That's because compared to other diseases, Dr. John Crosby says measles is far more contagious. On average, the National Institute of Health says one person with measles can infect up to 18 people. COVID averages up to 4 people by the same measure, and flu is just over 1. The virus can also survive for an extended period of time.
If somebody has measles, goes into a room, coughs, and then leaves the room, you can still get measles from that room 2 hours later.
Which is why spaces like this are some of the most at risk if the virus reaches them.
I know folks are probably really worried about this right now, and it is something that we need to keep our eye on and take very seriously.
Children less than a year old typically aren't able to be vaccinated for measles. If they're younger than 4, they can't have the second dose yet. Jillian Van Loo says they rely on others to be vaccinated.
They really benefit by the rest of the 1-year-old, 2-year-old, 3-year-olds being partly vaccinated, and by the 4-year-old and 5-year-olds being completely vaccinated.
Across Iowa, vaccine rates complicate that. Data shows about 84% of 2-year-olds in the state are vaccinated for the virus. The CDC says that number needs to be at least 95% to prevent an outbreak. But in Polk County daycares, Van Loo says the odds are better.
Our daycares and our schools in Polk County do have quite high vaccination rates, particularly our daycare centers where they're really paying close attention to these communicable diseases in those really early ages.
And measles symptoms include a fever, cough, runny nose, and red, watery eyes, and of course, that measles rash. It looks a little bit something like this. So if you suspect that you or your child might have measles, call the doctor before heading to the clinic. Healthcare facilities do not want their waiting rooms exposed to the virus. Ben?
Yeah, with all the information you gave, Pepper, you can understand why. Thank you.